everyone. Hello, Lina. How are you today?
All good. Welcome
Welcome
to
to Lina and
Lina and
Rada's
Rada's show.
show.
Yeah, we try to synchronize that, guys. It's hard sometimes, but that's the idea. So, Rada, beautiful day today. Is the second day of spring already.
Yeah, 22 degrees outside, very warm and nice,
It
but we
looks
are locked down.
beautiful. Yeah. Well, we still have a couple of weeks to go, so hopefully we are going to be able to enjoy this weather soon enough.
Yeah, hopefully we can't wait.
Yeah.
Anyway, so today we're going to talk about a great topic, and I'm sure you're gonna love it. So it's about infection control.
True. I think that's the topic that everyone asks a lot. Well, they ask a lot about of things, but I think infection control, particularly for the practical examination, is it's quite important. We have seen and we have heard stories about people that just failed the exam because they had failed infection control, even though they have passed everything else, because
Mm.
infection control itself is a single cluster. So if you remember that you need to pass every single one of your clusters in order to pass the exam. So if you fail infection control, well, and you pass everything else, that's quite a downer. So definitely
Yeah.
the subject for today is quite interesting. We are going to discuss a little bit about infection control on technical day and also in the clinical skills day. So the first thing that we are going to do is to share a presentation with you guys, because I don't know if you are agreeing with me right on this, but when you see things, I think it's easier for you
Yes,
to locate yourself in the surroundings.
definitely.
Okay, doc. So let me share my screen here with everyone. And
Great.
perfect. Okay, guys. So we already spoke about infection control on clinical and technical day. So first things first, Rada, let me show you this one here. So starting with the technical day, some people can have the technical day first, some people can have the technical day in the second day of the exam. That's definitely not that a big deal. You can have preferences, but at the end of the day, what they schedule for you is what you need
They
to do.
decide. Yeah.
Yeah, true. Okay, what do we have here, Rada? Does this bring memories to you?
Oh, yes, I can recognize my chair there.
Oh, you know what? In my exam, I had that first one. I was
I
sitting there.
I had the last one just close to the window and
Oh,
the like
really?
the yeah, yeah. So yeah, it brings up nice. Now I'm on the other side of the fence. Nice memories, but that day, yeah, it was okay. But yeah, it was. We didn't know if we're gonna pass, and yeah,
Stress.
after weeks of hard work and all that, it was finally the day of showing what we can do and yeah, give the best. So this is the room of technical day, which is bigger than that actually. So here, as you can see, you will have kind of little stations with two chairs facing each other. So you'll have two candidates there. So on the so you'll have to focus on your patient, the bracket table, and the trolley. So they put this trolley there, but in fact it will be on your right side. And on the bench there, you'll have the amalgamator, the different containers, a sink, and like a station just to wash your hands and dry them. So next, we wanted to show you how you'll be positioned. So you'll have your mannequin where you're going to focus and spend the most of your time on technical day. You have your bracket table. You have your trolley on your right side if you're right-handed. Yeah, that's pretty much how you are gonna see yourself. Yeah.
Yeah. So this photo this photo and the previous one, we have taken those, like a little disclaimer here, from the Australian Dental Council website. So this is not something that is hidden somewhere, guys. I mean, anyone that wants to do some research on the web in order to see what they are going to face, you will find these images in the web page. Like Rada said, that big room is going to have 12 stations. So it's bigger than what you saw in the previous photo. And in this one, we just want you to tell you that basically you will have your trolley next to your right-hand side and your bracket table. And pretty much between those two things, you are going to be pretty much spending your whole day. And between those two areas, you need to be very mindful of the infection control flow that you are going to have there. This picture is not the best picture in the world. We can see some infection control violations in that one,
Yeah,
but it shows
totally.
it shows quite clear basically what you are going to have around you the day of the technical day. So in order to start to talk about that trolley, basically what you want to emulate at home in order for you to be used to that flow, you want to emulate what you are going to get during the exam. So here we have some examples of some things that we already have set up at the Institute at Dental101. So this is a trolley that is pretty much like the trolley that you get in the day on the exam. And basically what you will get on top of the trolley is what you are seeing there. The transfer tweezer, and you are going to get your restorative cassette. I think the cups, you can take them from the drawers. We will show you that later on.
Yeah.
And also the temporary material gun is not something that is going to be from the start on your table.
Yeah, you will have to take it from the
common bay.
The common bay, and you will have to put it on the top of the trolley because the bracket table is quite small. So if you want to make sure that nothing drops from it, but yeah, mostly it will be in the common bay. So as you see, you have the instrument cassette with the different restorative instruments. Mainly you will have the transfer tweezers, as Lina said, and the cups that you will have in another drawer. So you have just to organize yourself whether you want to keep that these cups here, put one or two on the bracket table, so that's up to you.
Yeah, so basically the photo next to the trolley is one that is in the Australian Dental Council practical examination package, information package. So you actually know what instruments you are going to get the day of the exam. And remember that you are going to receive that tray closed because you will have some sharps in there. So that means that when you are leaving your station at the middle of the day and at the end of the day, that tray should be closed as well, just to prevent any infection control violations. I think in Dental101 YouTube channel, we have a video of instrument identification. Each single of those instruments that you are seeing in that photo, we talk about a little bit on one of those videos. If you want to just, go and subscribe to Dental101 YouTube channel, you can see that video with the instruments and their basically indications. The transfer tweezer is quite important here because it's quite easy to misplace the transfer tweezer. It happens that sometimes we take the transfer tweezer for the trolley and we put it in the bracket table. That means that's immediately contaminated, which is not a big deal unless you don't realize you have made a mistake. If you realize that you have misplaced your transfer tweezer onto the bracket table, then you raise your hand and you tell the examiner that basically that has happened. The examiner will ask you, what will you do? And you can tell basically that you will put that one in a sterile room and bring a fresh and clean tweezer there. And they will just put it back again in the transfer tweezer tray, and that will be it. So that's not really a big deal unless you put it on the bracket table and then you put that one back on top of the trolley and you think that no one saw you, or so you need to be mindful of you need to be mindful of the transfer tweezer.
Also be mindful that you don't swap the position, like you place the hooks on the clean area of the little tray and the handle on the dirt side.
Yeah. Basically, the trolley is there. You don't need to do too much with the trolley, to be honest. Make sure that when you go into the room and that day, and because they are going to give you some time for you to, before the examination starts, you will have some time to open the, you know, the trolley to see what's in there, and then you position the trolley at the reach that you want to have the trolley. So make sure that you have the time to do that, so you don't have to do anything with it once the exam is conducting.
Mm.
And I think that's pretty much for the top of the trolley, right, Rada?
Yep. Yeah.
Okay. And I think that the temporary material gun that you see there, it's because when you ask for that at the common bay and you have it on your possession, well, there's no other place to put it rather than on top of the trolley, or pretty much on top of that tray.
The bracket table is quite small, so
it's quite small. Yeah,
we won't recommend you to put that gun there because it can fall, and yeah, if it falls, we need to say about the viva and all that. So to avoid any stress, just let it on the top of the trolley, which is perfectly fine.
Yeah, agree. And if we are going in more detail to take a look what you are going to find inside of that trolley, the first drawer, this is basically an example of what you are going to find there. You are going to find some appendicious that you are going to use for your amalgam, the alcohol swabs that we use for cleaning the temporary crown, cotton buds if you need them.
Yeah, you'll have lots of little, bless you. You'll have lots of little material inside. So this is just an example, but you, as far as I remember, you have lots and lots of things like different wedges. You'll have even the 3D system at your disposition. So remember just to open that drawer with the hook of the transfer tweezer, not with your gloved hand, and close it again with the hook because it's a clean area. You open with the hook, you grab your stuff, you drop it on the bracket table, and then you close with the transfer tweezer, you replace back the transfer tweezer in its correct position.
Correct. And also the things that you take from there to the bracket table, don't go back in that drawer. Because if I take a Softlex disc and I polish something in the mannequin or the patient in this case, that is already contaminated, that's disposable. You just need to dispose that in the sharp container. If you are talking about a Softlex disc, those things cannot go back into the drawer. So basically that's the flow. Things can flow from the clean area to the dirty area, but from the dirty area, nothing goes back to the clean area. So that's quite important for you to take in mind as well. And if we take a look to the second drawer of the trolley, you will find bibs and I think some towels, right? Paper towels.
Yes, yes. And other little stuff, but it's quite empty as compared to the first drawer. So you'll have these cups as well. So it's not going to be written sharps or amalgam or whatever. It's just to show you how we can use these cups. But yeah, you'll have to organize yourself by using these cups so you can throw any sharps or any amalgam scraps, or if you want to keep like your potty keys in a cup so your bracket table remains organized, clean, professional. So yeah, basically you'll have that.
Yeah, I think you are going to need lots of things from the first drawer, from the first drawer. The second drawer, basically you are going to access it, I think, once, you know, just to take a couple of cups, and they are also very mindful of when you are working with the high speed, if you have any splashes of water on top of the mannequin, they are very mindful of that. So they encourage you to keep your mannequin clean as well. So you are going to have some paper towels in there that you can take and have at your disposal close to you. So if you know that you are, I don't know, preparing a canine, an upper canine, and you know that you're going to spray lots of water into the patient's face, you can use those towels just to dry the face, because they will encourage you to keep your mannequin very tidy as if was your real patient.
Yeah, it's just about to show care to your patient. So
yeah,
you would do that in real life. So you
True.
just do as you have a real patient, not a plastic one.
Yeah, precisely. And the third drawer basically is the drawer for your eyewear or your loops.
Yeah. So already when you come inside the room for the first time, they will ask you to place your goggles or your loops inside that drawer. So you will open that drawer with your bare hands because it's not the beginning of the exam. Then once the exam starts and you wash your hands, you do your PPE, you at after the mask you have to wear your loops or your goggles, so you have to go back to this drawer, take your loops or goggle, close and wear that, and then you continue with your PPE protocol. Again, when you finish at lunch break or the whole exam, the whole day, you will have to do the PPE, remove the gloves, hand sanitize, place back the Google inside the drawer. Then you go back, you remove the mask, throw it in the bin, and then you wash your hands.
Correct. So basically that drawer is just for your eyewear or loops, and you will receive precise instructions from them in a video previous to start or commencing the examination. So that's quite straightforward there. So that, I think that's everything for the trolley and top of the trolley. Then you will have your bracket table, and on the bracket table, the lamp is here because probably we set up this for a mock test at Dental 101. But that light cure is going to be attached to the chair at the day of the exam. So that technically is not going to be on top of your bracket table. What you will have is that little cassette, your bird kit, your flowable composite, and a little mixing well with composite, bond, and edge. And that is going to be sealed with a lid because obviously the light can cure the composite and the bond. So that's what you are going to get. If we want to take a better look of what's inside of that little cassette, you basically will have your examination kit in there.
But bear in mind, sorry, Lina.
That's okay, go for it.
Yeah, I just wanted to tell you that be aware that you will have a video in the beginning of the exam. It's about 15 minutes. They will give you lots of instruction about infection control. So really, I encourage you to be focused on what they are saying, because they can give you information and instructions regarding infection control. So for instance, from 2018, you had to wear the gown when the exam starts. But in 2019, when Lina and I gave the exam, we were wearing the gown, the additional protective gown, beforehand, so before the start of the exam. So maybe they will change stuff. We can't predict. So really, really be focused on what they're saying, because maybe they will give you an instruction and you will be marked on that.
Definitely. I think that disclaimer is quite important, Rada, because what we are telling you guys here is what we have experienced.
Yes.
At the moment that we sit for the examination, or we sat for the examination. So doesn't matter what Lina and Rada are saying right now. If the day of the exam they give you a different instruction, that's what you follow. Doesn't matter what anyone else says. So that's what you need to focus on, especially because we know that these exams are going to come back after this pandemic. So infection control could have some changes, and they will give you different instructions, because now we need to get used to this new normal after the pandemic. So I think probably some changes can be in place. So just be mindful of that video, of those instructions, and just focus on that day. Don't pretend to know that because you have seen some sessions or you have had some assessment from someone or some institute, you already know what you need to do and you don't need to pay attention to the instructions over there. That's not the case. And basically that's a bracket table. As you can see, there's only a few things on top of the bracket table. That's because, like Rada said, the bracket table is quite tiny. Everything is quite tight in there. They are also going to encourage you to keep everything tidy. When I sat my examination, I saw the examiner telling off people because they were having too many things on top of the bracket table and they weren't tidy enough. So they also pay attention to that. So make sure that you keep this as clear as possible. Just use the things that you need to use for a particular task, then you clear everything, and then you use the following things that you need for the following task. Okay, guys. I think that's pretty much it, Rada, right? For bracket table and the trolley that you are going to have over there. So I think that's quite clear there. Remember, guys, when you are going to see this video, since we are recording this session, you are going to be seeing the video already recorded. We are going to be live with you watching the episode as well, the video as well. So at the moment that you are seeing the video, yes, you can submit your questions in the comment box and just ask us things, because we know that infection control is a subject that arises many questions, you know, and you guys would like to have all the answers. Probably we don't have all the answers, but we will try to tell you what worked for us the day that we sat the exam. Okay, and now let's talk about our clinical skills day, which will be the second or the first day that you will have, depending on the schedule that ADC give to you. And in that clinical skills day, you are going to see 10 stations, but stations 1 to 6 are going to be communication stations. So for those ones, there's nothing in particular about the infection control that we can tell you right now, because there you just need to go in there, sit and start talking, basically. You don't need to wash your hands unless, again, they tell you otherwise during the instructions. And then you are going to have 4 remaining stations that are going to be the so-called skill OSCE stations. And those ones, yes, you need to be mindful of some things regarding infection control. So I'm going to show you this picture here.
I just want to add, sorry, Lina, again, this day you will have a video, 15 minutes again, same in a room. You will have to watch it. They will run this video with the instructions made especially for that day. For the 6 communication stations, you don't have, as Lina said, to do any PP or whatever, but bear in mind that you will have to keep your gown. Don't remove it or change or whatever. Just keep it and have your tag just displayed. That's it.
Yeah, definitely. And those 4 stations are going to be basically a room that has a chair, and you will have a task to fulfill in that particular room. So if you take a look to the photo, this particular station is, this particular photograph is taken from the ADC video that they have put recently in their webpage. So this one is showing the X-ray room. So basically you will come into the room, you will have a screen, and on that screen you will have your task, you will have your reading time, and after your reading time it's over, you will have 10 minutes to try to perform the task that you were assigned. I think, and as you can see here on the photo as well, you are going to have a sink, so you can actually wash your hands, paper towels, face mask, and all sizes of gloves. You are going to have everything at your disposal over there. So if we try to remember, okay, that's another angle of the photo, right, Rada?
Yeah. So you're going to enter this room. You'll have the examiner that will mark you. So you'll have these 3 minutes to read whatever is written in the screen that you see on the wall. And yeah, you will have the area, the clean area where you have the sink, the gloves, the paper to dry your hands, and some cups as well. And at the back, you have the trolley with the instruments.
Exactly. So in this photo, you can see the examiner peeking through. So that's what you will see, an examiner that is going to have an iPad on their hands, and the examiner will be scoring you as you progress with the task. So I think probably Rada has mentioned that before, or this before, and it's that, I mean, don't be stressed if the examiner is very close to you, because, well, the examiner needs to see inside of the mouth and how you're doing things. So, you know, some examiners can be away from you. Some examiners can be very close to you just for them to assess your work. So just, you know, focus on your task, and you don't have to talk to the examiner. You don't have to say anything to the so-called patient as well. And in this particular picture, the clean table or the clean area will be behind the examiner. You will have at the back of the room a little table that is going to be clean area. And obviously everything that is dirty is your bracket table. So if we want to take a look what you will have on your bracket table that we have named here for the purpose of the video as dirty area. So that's what you are going to get. Depends on the task. If that's going to be a task, I don't know, regarding fissure sealant, you will have probably a bird kit in there and you know, handpiece. But if it's just taking the X-ray, probably it's just the exam kit. So it depends on the task that you have over there. And if let's imagine that the task
is the matrix band.
The matrix band placement, exactly. So this is just to give you an idea that if you have a task like the matrix band placement, you will have all sorts of options to choose from to perform your task. I think they will have also the sectional matrix.
Yes,
right?
Yeah. We had I had this task in my exam, and they proposed you the sectional matrix. I think it was the V3 system that they were allowing us to use, or the classic Toffelmeier and
good old Toffelmeier that some people love. Exactly. So you will have different options, and basically the idea here is that you take from this clean area, you can take the things that you are going to use. It's not a problem if you take extra things. And by that, I mean, I do remember that I have this task as well in my exam. And what I did was to take with me one size 1 and one size 2 band. Just, you know, just to be sure. Because once I put my gloves on, if I need to go back to that clean area, I need to do it either without my gloves and my hand sanitized, or with a transfer tweezer. So if you don't want to do that, especially not because that's a problem, but because you have 10 minutes. So if you want to optimize your time, if you want to take not just one wedge, but 2, because you have 2 different sizes, you can do that. That's not a problem, actually. The important thing here is for you to know that this is clean. So when you put the things on the bracket table, they should stay there. And if you need to go back here to take something, you can do it either with your transfer tweezer, or you will need to remove your gloves, sanitize your hands, take it and put your gloves again, and so on.
Which add more time, wasting time, more stress. So we do recommend you during the 3 minutes, when you read the scenario, not only read the scenario, but also go and have a look to your trolley, what they are proposing, what are you going to take, you know, build the strategy in your mind. So once you have this ring, thing, you know that you are going to start. So you wash your hands, you place your mask and your goggle or your loops, whatever. Then you are gonna take your instruments, you're gonna drop them in the on top of the trolley, the bracket table. And then you're gonna hand sanitize, wear your masks, your gloves, and sit. Also, I want to remind you that the stool is clean. If you need to do any change, you have to do it before gloving. So if you need to adjust the stool on your height, depending on your height, then you have to do it after washing your hands, wear mask and the loops, and then you adjust, then you go back to hand sanitize and gloves, or back to the trolley, pick up your instruments, and whatever how you want to do it. But
exactly,
yeah,
that's quite important.
Bear that in mind.
Because you have two options. Either before you do the gloving, you adjust your seat. I do remember that in one of these stations, I forgot to adjust my seat when I was, after I gloved myself. So what I did was to adjust the chair to my height. So don't panic. The thing is, don't panic, and try to use your time, be wise with your time. So if you forgot to adjust the stool, that's okay. Just lower the patient, or put the patient a little bit higher. The important thing, and if you cannot do it like that, then the glove, sanitize, adjust your stool, and come back and do it. The important thing is that you can do your task in a comfy manner, so the result could be the best.
Exactly. So,
and I think that's pretty much it. No, I think that's pretty much it, Rada.
Perfect.
That's basically what we have. Yeah. That's a very good overview. I will have loved to have something like that.
Oh, yes.
Yeah, before. So everyone that is waiting for the practical examination, you guys already have an advantage, which is there's a lot of batches that we already have been there. We can tell you some things. Again, what we say probably is different from what you are going to hear that day, because of any changes that they can make. Just stay with them.
Yeah, follow their instructions and you'll be safe.
Definitely. Okay, guys, so we will wait for your questions. Thank you so much for watching us.